The second most common pathology that I may see is Achilles tendonitis. And Achilles tendonitis may come along with plantar fasciitis, by the way, because it still has involvement at the heel. We see a lot of Achilles tendonitis with high arches, and we also see a lot of Achilles tendonitis, and I hate to say this, I'm not being sexist, but with women who wear high heels. So as many of you know, the Achilles tendon comes back down the bottom of the leg, and it attaches right about in here. And it can, through either trauma, sports injury, or from wearing high heels for a long period of time, lose its elasticity, and it can either tear or become compromised. So as another itis or an inflammation, it can be very, very painful. Now, again, it's one of those pathologies that I see so much of and does come so often with plantar fasciitis that we really do have a pretty simple way to correct it with an orthotic and the proper shoe. And we will also talk about and give instructions as to how to mitigate the problem. And we will do that in most cases with your physician if you would like us to. So that is Achilles tendonitis. So now that we've gone through plantar fasciitis and Achilles tendonitis, I want to go to the next one, which is the idea of the ball of the foot. And the ball of the foot are called the metatarsal bones, but they're the metatarsal bones there's 5 of them, and they are right here. But metatarsalgia normally occurs at what we call the head of the metatarsals. So we have the head, we have the base, which is the main part of the bone, and we have the shafts, okay? Metatarsalgia occurs typically along here. And it can occur for a number of reasons. It can occur because of flat feet. It can occur because of high arches. It can occur because of really bad footwear, normally very high arches or very high heels. And think about that. It makes sense. If the foot is raised in a high heel, it will then be tilted upwards. The metatarsal heads will be tilted upwards, and we see a lot of women that will have pain at the bottom part of the metatarsal bones. So that's metatarsalgia. It can occur for other reasons too. Along with metatarsalgia, we will many times see another subpathology that typically will occur between what we call the interspace, which is the second and third metatarsal heads. And that's called a neuroma, or Morton's neuroma. And basically, it's not as bad as it sounds, but it is very, very painful, and it can be corrected. If it goes untreated, it has to be surgically corrected. If it goes treated with a good orthotic and also a good shoe, we can effectuate some comfort there. And the reason why that happens is because the foot is in such a wrong position, or a flat foot or a high arch, that we're getting a pinching here in this interspace on the nerves that go through the foot, so the forefoot. So that's kind of like a sub pathology of metatarsalgia, and it can happen many, many times. So if you feel burning in between your second and third toes, or first and second, third and fourth, it could possibly be a Morton's neuroma or inflammation. And of course, I can't diagnose that, but your doctor would have to do that, but it's something that I do treat, okay? So that is the third pathology. So we've talked about some pathologies. Let's just talk about very quickly some foot shapes and foot patterns. So many people, there's 3 types of feet. There's normal feet, which of course I don't see a lot of, and then there are what we call flat feet, which would look sort of more like that, okay? And then there's what we call high arches, which would look more like that, and that would be the inside arch, okay? And then there's just the normal foot. You can see with the normal foot that the tibia, which is the big bone running down the inside of the leg, is nice and erect. With a flat foot, you're going to see the tibia move this way. With a high arch, you're going to see the tibia move that way. And in the rear foot, with a high arch, you're going to see the heel go that way. And you're going to, with a low arch, you're going to see the heel go that way. So they each have their own characteristics, and they can all three be can be mitigated a bit with a good orthotic and a good shoe, which is what your podorthist will bring to you. So, flat feet. The primary reason why flat feet occur, which would be this, okay, you can see these bones almost sitting on the ground, is genetics. It can be trauma, and it can be bad footwear, walking on hard surfaces without support, and it is the most common thing that I see. What do we do about flat feet? Well, the thing that we want to do the most, again, we see that tilting, right, is we want to take that heel and the knee, and we want to straighten it up with a good orthotic. And I'm going to talk about the properties of orthotics for each of these types of feet in a different video, but I wanted to just show it to you. So when we have the foot in this position, in a flat foot position, and then we straighten the heel, you can now see that everything gets into a normal arch, and that's what we want. Very easy to correct with a good orthotic and a good shoe. The flat foot is typically more flaccid. It will overmove versus a high arch, which can be a lot more problematic. High arched folks typically have outside ankle sprains, sciatica, hip pain, and the characteristic of a high arch, which is this, again, is an inward tilt of the bottom of the heel, an outward tilt of the knee bone, and we are also walking on a very, very rigid foot. This foot, unlike the flat foot, which is hypermobile, this foot is very rigid, and it causes many, many problems because instead of it coming off the first toe properly, it stays in that position and it more rocks. Orthotic fabrication must be much more careful and utilizing the proper materials for it. So those are the three main foot pathologies and the main types of feet. The three main types: normal, flat, and high arch. High arches are actually my specialty. I love working with high arches because it is such it's not just a science, but it's also an art form. And I kind of enjoy that because it's always a combination of different types of materials to get the patient comfortable. So that is, those are the three types of feet. And at the end of this video, we'll have information for you to reach out to us. And I'm always happy to talk to you for a free consult on the phone. And if we decide that it's worthy of some time together, we're happy to do that. Okay, thanks so much, and everybody stay safe.